Okay, so just
I think we can start. Good morning, afternoon, evening, ladies and gentlemen. Welcome to today's webinar on innovation and research commercialization. As researchers, we often focus on creating impactful innovations. But how do we take those breakthroughs from the lab to the market? Today, we will explore essential strategies, tools, and pointers to help you navigate the complex world of commercialization. Next slide. I am going to moderate this session, and I'm so excited to host two amazing speakers today for this exciting webinar. Next slide. I myself has a kind of experience in the innovation sector, but I still need to learn so much. And that opportunity is today for not just me, but for so many other researchers, innovators, entrepreneurs, and public health consultants and professionals. I am the founder of Care All Life, that is a health literacy platform, and I conceived it together with my co-founder, Dr. Luz, who is also the alumna of IMPH. And let's go ahead and discuss the basic house rules. Next slide. So first, Uh, yeah. So first, let's learn about what is Public Health Innovation Hub. Why are we all together? Why are we talking about alumni of International Master in Public Health, Hebrew University of Jerusalem? So this is basically a platform that we all, as alumni of IMPH, have come together and initiated a platform and organization so that we can enhance collaboration and innovation leadership in public health by connecting professionals with research, resources, and collective problem solving opportunities. From courses to policy documents, solutions, webinars, consortia, partnerships, you name it, and it is going to be there, not just for IMPH students or alumni, but across the world. Next slide. We are going to have our presentations from two amazing speakers, that is Dr. Obichi and Dr. Nathaniel. And then we will have open platform to ask any questions that our participants might have. And at the end, we'll have closing remarks from Shira from our IMPH. Next slide. So here are some basic rules that we all have to follow. We have to respect our speakers, and that's why I would request you all to please keep your mic off during the presentations. This webinar is going to be recorded and live streamed in YouTube as well, so that you can later on also watch it. You can post your questions in the chat, and these will be addressed during the Q&A session. Let's go ahead. So without any ado, let me introduce you to our first speaker, Dr. Obichi. Next slide, please. Dr. Obichi has 15 plus years of entrepreneurial experience. He's the co-founder of AI-enabled healthcare startups. He has amazing innovation leadership experience and is a public health physician. He is the chief facilitator of the Nigeria's Tertiary Education Trust Fund. And we cannot wait more to listen from Dr. Abichi himself. Welcome, Dr. Abichi. The platform is all yours.
Thank you so much, Nridula. It's such an amazing privilege to be here with all of you to share this platform and to discuss a very critical topic this afternoon. Welcome everyone to the Public Health Innovation Hub webinar. This is to say good afternoon from Nigeria, from Abuja, and then wherever you're joining from the world, you're welcome. Okay, so can I control my slides? All right, so we're going to be looking at Introduction to Innovation and Research Commercialization. We're going to be looking at overview of the processes and importance of bringing public health research to market. Now, this is important because the people we have in this call are public health, mostly public health practitioners, medical doctors, people with some health background. This webinar is simply going to be for us to have an insight into how to just not be public health practitioners, but public health innovators. Now, the outline, we're going to be looking at the problem we're facing. What is the problem that we're facing today? Why we need to become innovators, not just practitioners. We're going to be understanding what exactly innovation is, becoming a public health innovator, what is research commercialization, approaches to research commercialization, commercializing your research and concepts, what key questions must you answer, then barriers to solve, challenges of research commercialization, then we wrap up. The aim of this whole conversation this afternoon will simply be for you, by the end of this section, to have this appetite, an increased appetite to want to go out there and do something quite unique with your public health skills or expertise. We want to see how that you're going to be part of the people that are going to solving critical problems and own your solution basically in the public health arena. That is the whole essence of what we're going to be discussing this moment. We want to see that public health practitioners will not just be mere practitioners, people that are implementing solutions developed by others, but people who own their own solutions and decide the vision for it, decide the pathway that these solutions are going to take to its end. That is what we're supposed to be discussing here, and that is the whole essence of this network. Now, please, I want to ask if I can really control my slides. Please enable me to control, or I can share my slides so I can control, please. It's important for me to.
Basically, I can't make you a co-host. So I'll have to change the slides for you because we have inserted it into the main slide. So I'll have to change it for you.
Okay, let's see how that goes. But it's not going to, you have to check what you can do to make me control the slides. So please work on that. Enable me, make me co-host so I can share. Now, the why are we doing this? We're doing this because of inequity in healthcare. We know that there is global health disparity. Global health disparity is a factor. And this is really why we are practitioners. This is why what we are doing out there to solve this problem of inequity. Now, we cannot solve it adequately enough without understanding how to own the solutions. Basically, what we have been doing all the while has been a situation. We go out there, we try to implement the solutions developed by others, the visions of others. But that is really not how we can drive this whole vision of solving the problem of inequity in healthcare. Now, the numbers are very clear, right? The first thing, as we see here, is life expectancy at birth, being global average of 72.6 years. In high-income countries, you have 81 years, and then in low-income countries, 64 years, according to World Bank. Okay, next. Under 5 mortality per 1,000 live births. By 2020, you have global statistics to be 37 deaths. And high-income countries, 67 deaths. Low-income countries, 5 deaths. You see that? So you find the disparity is such wide, so you find out that this is a problem. Why that no matter how much is spent in public health interventions, we have a problem in our hands. And it will take public health practitioners themselves to step in there, know the problems themselves, and then create solutions to solve these problems. Look at this data where that sub-Saharan Africa's health workforce, 3% of global health workforce is just what sub-Saharan Africa is contributing. Moreover, sub-Saharan Africa has 24% of global disease burden. Amazing, right? Now, NCDs, non-communicable diseases, 71% of deaths are caused globally by NCDs. However, 85% of these deaths are contributed by low middle income countries. That is the disparity we discussed. And we even saw this with the recent COVID-19 pandemic, the amount of vaccines that came to low middle income countries. And so you see, global health disparity is a reality. And what we have to do as innovators would be for us to take charge of the process, get out there and try to solve these problems, contribute to solving these problems as experts themselves who are in the field, who are experiencing these problems firsthand. Now, we know what to do. What is it that we know to do? I'm going to put some people. Now, Dr. Paul Farmer, co-founder of Partners in Health, says that the idea that some lives matter less is the root of all that's wrong with the world. Innovation in public health is crucial for addressing the disparities that lead to this injustice. Innovation in public health. Okay, I'm still expecting that you give me, the privilege to share. Please, let's control the slides. Innovation in health technologies. Now, this is according to Margaret Chan. Innovation in health technologies is critical for tackling the most pressing health challenges and reducing health inequities. Innovation in health technologies. Now, this is, why this is important is, you see, we all know what we need to do, which is what? Innovate. Innovate. Now, Tedros, current Director General of the World Health Organization, says innovation in healthcare is not just about developing new treatments, but also about finding new ways to ensure these treatments reach those who need them most. So beyond creating these solutions, there's an amazing thing that happens with creating innovative solutions. When you create them, they also have a way to filter into the systems that will drive them, right? So that is one of the ways in which we can build formidable healthcare systems in places that are unreached. And that is through innovation. Okay, next. Question then becomes, what exactly is innovation? Innovation refers to the process of creating and applying viable new offerings. Creating and applying viable new offerings. That is what innovation, and it's important for you to take notes of the word viable. In the context of public health, innovation involves developing novel solutions to address public health challenges. Improving outcomes and enhancing the efficiency of health systems. Just look at it, right? It involves new solutions. If you're able to develop a new solution that is able to improve outcomes and enhance efficiency of health systems, that is an innovation in public health. So this now, I believe that we've settled this, the definition of innovation. Once we have this cleared up, then we can move into the next slide. How is innovation different from invention? Whenever I talk about and I discuss this, I like to make this very important distinction. Innovation is different from invention, and the difference is simply viability. As we saw in the previous slide, innovations are supposed to be viable. Meaning they're supposed to be sustainable. Please, can you go to the previous one? Meaning they're supposed to be sustainable, meaning they're supposed to yield their weighted cost of capital, right? So you have solutions, you have interventions that are not sustainable. When someone is, giving you an intervention, someone has given an intervention, and you are a practitioner is implementing those interventions. Whenever they stop funding, that is the donor. Whenever they stop funding, that is usually the end of that intervention, because there is no viability built around it, around that solution, right? Around that intervention. And that is the problem we're having. Seeing that interventions may start, but since there is no viability to it, there's no viability in the sense of those solutions being sustainable and being able to pay for its continued production and implementation and use. So in that sense, once the source of funding stops, that solution ends. But innovation is different. Innovations are able to come with them innovative business models, sustainable business models that are able to drive these interventions. And this is viability, the viability element. Okay, next. Aid is short-term, but innovations are rather long-term. Let's look at, can you click? Let's look at some quotes that talk about or stress on the need for innovation instead of aid. Still on the need of innovations being of us focusing on investments in innovations instead of what? Charity and donations to drive our public health initiatives. We need to move from a mindset of charity to one of investment. When we invest in health, education, and infrastructure, we're investing in the future of our world. That is the former president of the World Bank. Okay, next. Now, President of Rwanda would say that aid leads to more aid. The new approach we need is to move from aid to investment, invest in the people, in their capacities, and they will create their own development. That is it. Aid is short-term. It always leads to more aid. So when we invest in the people, when we create innovations, you find out that the capacities and the competencies of people are developed, and that is the real development. Next. We need to think of aid as an investment, not as charity. Effective aid should empower people to take charge of their own development, and that is Kofi Annan. Now, what proportion of funding goes to healthcare technologies in Africa? Now, why I'm talking about this is simply because you see a lot of funds come into Africa for healthcare. In fact, in 2018, in Nigeria only, it was almost $1 billion that came into Nigeria for healthcare purposes and charity, around 800 and something thousand million dollars. Now, that is critical. But just last year, the amount of funding that came into Nigeria for healthcare interventions, healthcare investment in healthcare for healthcare innovations is just about $300 million. $300 million. But way back 2018, the funds that came as donations and charity and all of that was that much, almost $1 billion. So what we're saying here is that we need to now look at the fact that healthcare is lagging behind when it comes towards investment opportunities in Africa. Can you click now? Now, if you look at this chart I got from AVCA, you find out that healthcare just has 9% by way of volume of investment in 2023. Aspect sectors such as finances, IT, consumer industries, the industrials, they have more investments proportionally. Now, if you look at the value of investments, in Africa, just 5%, healthcare had just 5% of investments. Now, what this shows you is that apart from other factors, regulatory and infrastructure and all of that, public health practitioners and individuals that should be playing in healthcare, because we are the ones that understand the problems. We are the ones that understand how to begin to solve these problems. We are not playing active roles in this. So what has happened is that the amount of money coming into investment in this area, in this sector of healthcare, is actually quite low, dismally low, as a matter of fact, and that shouldn't be. But it's not only in Africa. Let's go on, please. Go on. Now, let's look at even in India, because this is just generally around the global south. So you find out that number of deals for healthcare was just 15 out of around 840 deals, making it about 3% of deals from 2010 to 2020. But how about the money? In US dollars, for India, healthcare was just about 2% investment of all the money that came into the country in investment. Healthcare, just 2%. That is to let you understand what we're talking about here. We need to rise up as public health practitioners, and we need to embrace innovation and begin to do something in that sector. Okay.
Yeah.
Next, please. Now, should all of us become innovators? That's the question, because I'm trying to make the case here that, look, innovation is the way forward. Now, the question becomes, should all of us become innovators? Next slide. Now, it all depends. It all depends where you have found yourself. It all depends what you're doing. But the answer is truly yes. Please go on. Now, there are different types of innovation. The first one I want to talk about is incremental innovation. Everybody can actually engage in incremental innovation. Now, incremental innovation is where that you add on existing products and services and processes, you just improve on them. You add new technologies to them. You add new processes to them, just such that you improve on what the capacity is, on what the technology is all about, on what the service is all about. That is what incremental innovation is all about. Here, you want to make a small marginal improvement at every point in time. And this is in contrast to disruptive innovation. In disruptive innovation, we're talking about breakthrough technologies, breakthrough innovations, where that you're creating new markets, you're creating new customers, people are changing their behaviors in order to embrace your technology. In fact, with disruptive innovation, you see that costs gets to crash, right? Access is improved. remarkable change in the marketplace with disruptive innovation. So these are the two types of, even if you're not able to pursue disruptive innovation, you can start from incremental innovation. But the idea here is for you to keep solving a problem, identify a problem, find a way to solve that problem by either improving on existing technologies or coming up with just a completely new technology to drive change in a particular community or in a particular sector you found yourself. Next. Why shift from public health practice to public health innovation practice? That's the point here. Why do we need to shift from public health practice to public health innovation practice? Okay. One is we need to take ownership. We need to take ownership. I've talked about the fact that there are interventions. And of all of these interventions, the point is that we don't actually own these interventions. We don't take ownership of them, right? And there are ways you can take ownership. Number one is you own the vision. You decide the way in which those interventions would have to drive. You decide who exactly will own this, that this intervention is supposed to be about, which community, and decide for what period is this intervention going to be. That is you owning the vision. You also own the intellectual property. That is also in the taking ownership. Owning the intellectual property, owning the know-how, owning the data, owning the resources. These are the ways to take ownership of what the technologies, of the innovations, of the solutions, interventions. Now, driving sustainability is another way in which you can shift from becoming just a mere why we need to become innovation practitioners, because we want sustainability to those interventions. You want sustainability. How do you build sustainability? By ensuring that you have a sustainable business model. A sustainable business model, ensuring that the know-how, the knowledge is domiciled with you or within the locality. That is how to drive sustainability. Now, taking advantage of leverages. For someone that is an innovation, public health innovation practitioner, we have advantages. We have leverages we can build upon. One is what? The leverage of economies of scale and economies of scope. Because now you have the numbers, you can build on that, economies of scale, economies of scope. The fact also that you have the tacit expertise, you live with these problems, you understand these problems more than someone that is not living with the problems. You interact with the locals. So you have an advantage to developing a solution that is just meant to address these problems head on. Okay, the next, click. Revitalizing economies. Now, one of the things you would achieve by becoming an innovation practitioner would be that you can then create jobs, empower the people, you attract funds, because what happens is innovation has a way to soak up the funds. You can now get foreign direct investment. You can even export some of your technologies outside of your country. What happens is that you're revitalizing the economy. You're building a robust economy and contributing to the economy of your nation. Next. Now, how do you express your public health research? Go on. So just go on. Go on. So you have different ways in which we express our public health research: dissemination of knowledge, clinical practice guidelines, social behavior change, public health interventions, health system improvement, policy development, advocacy. These are different ways. But then there is an important one, which is commercialization. That is technology transfer. Click again, please. Technology transfer and licensing. These are the different ways in which you can express your public health research. We do a lot of these other aspects, but we rarely engage in number 7, which is technology transfer and licensing, commercialization of research. We rarely do that. So that takes me to exactly now, what is commercialization of research? That is what we want to start doing more of now, getting involved in transferring our knowledge, transferring our expertise. Can you go to the next slide now? What is technology transfer? This is the process of transferring knowledge, technologies, and innovations from research institutions, universities, or corporations to the marketplace or society at large. Next. It involves three things: identifying potential applications of research, protecting the IP, and facilitating partnerships and agreements that enable commercialization and practical use. Now, this is important. As we practice public health, as we work in universities and do research, the thing is this: we can begin to come up with concepts to drive into the larger society, into the marketplace, in order to solve critical problems that we encounter in our practice. That is what technology transfer is. And this course is simply to get us to begin to appreciate technology transfer and engage more in technology transfer. Can you go to the next slide? What is commercialization? Technology transfer and commercialization are actually just about the same thing. Technology transfer is one of the ways in which we can commercialize our research. And commercialization is the process of converting technological advancements into economical value through identifying the value drivers that define purchasing decision. Important thing here are the value drivers. So as a public health practitioner, one of the things you want to understand is what are the value drivers that will get my market, my community, my target users to want to engage with my products, with my solution. Can you go to the next slide, please? So there are three approaches to this. Demand-driven approach. Next, accelerated approach and supply-driven approach. Next slide. We're going to just briefly explain these three approaches. The supply-driven approach. The supply-driven in public health is simply when you decide on the solutions based on what your interest is, what the interest of the research team is, what the research team decides to do, and it's always donor-driven. What the organization, the organization decides this is what we want to do from anywhere in the world. And then once they make that decision, irrespective of what the situation is with the population in question, they drive it. That is supply driven. Can you go on? It's donor driven, right? This is donor driven. The donor decides what they want to do. That is one approach. Sometimes it's not entirely wrong. It's not entirely wrong some of the time, but it is supply driven. It doesn't take into cognizance so much as to the real issues, the priorities of the communities. Demand driven. This is where that you go ahead to prioritize and understand the needs and the desires of the target population. Here, the emphasis is understanding the real problem which the target population has. And when you understand that, you build a solution that will really, really solve that problem for that end user that is in question. And this one now is community driven. Can you click on next, please? This is community driven, is consumer market driven. Now, accelerated research. Accelerated research is when you are engaging the healthcare sector, the public health sector, you're engaging the industry. And a typical example of this was during the COVID-19 pandemic. The Oxford University was partnering with AstraZeneca to develop a vaccine, right? So there was a demand from the industry. And then the research institution collaborated. That is accelerated innovation. This is really very powerful because with this, the researcher doesn't really begin to pay so much attention as to what the market in itself is talking about. The thing here is that they are going to leverage on the the industry's capacity. The industry has built capacity already. The company that is interested in this technology has built capacity. So what you have to do is to plug into that opportunity which they have given to you. Develop a technology, build up your research and transfer that research, license it to the industry. That is accelerated research. This can be very, very effective approach for commercialization. Next, please. Okay, that's in the so. Are you ready to commercialize your research? Next. The first thing you want to do is to ask the right questions. And there are questions you must ask whenever you're interested to now go on, because whether the appetite, look, you have to commercialize your research, you want to go on there to do something, there are questions to ask. I'm going to quickly run through the 12 questions you want to ask when you want to get on there to drive innovation. The one is, what is the public health need or problem being had? You have to be specific exactly what you want to solve. What is the problem that you want to solve? And what is the value proposition? In other words, what is your unique selling point? What is the real thing that is different that you're supposed to share with the market? What is the market potential and demand for your solution? The point here is that you have to make sure that the market is eagerly in need of that your solution. You don't just build something because you feel good about that technology or that solution. No, you just want to make sure that there is a market and a demand for it. What are regulatory and compliance requirements? That goes without saying. What is your business model and go-to-market strategy? You must pay attention to your business model. How are you going to make money and drive sustainability, financial sustainability for this? What is the intellectual property status?
Sorry to interrupt. You have 3 minutes to wrap up, please.
Yeah. What is the intellectual property status? You want to protect the IP for this technology. Very important. Next, please. What are the funding and investment needs? You don't just get started without paying attention to how much you're going to use to drive this. What is the competitive landscape? Who else is doing something close to what you're interested in doing? How will you ensure adoption and engagement? Very important that you do, especially in healthcare. When you develop products in healthcare, it's not automatic that the community or the market would embrace it, because sometimes it comes with behavior change. So you have to come up with a strategy to ensure that there will be a diffusion of this innovation. Very important. What are the potential risks and mitigation strategies? Now, you have to already predict what the risks are going to be: regulatory risk, technology risk, financial risk, and how you can mitigate this risk. Go on, please. How will you measure success? And what is your long-term goal for this? Why are you into this to start with? What is your vision? Why is it important? Now, I'm going to have us, okay, let me just quickly run through this and then I conclude. The technology readiness levels. One thing is important because innovation involves, just go ahead and list all of them. Innovation involves product development. Now, product development is simply about you building new products for your innovation to address the problem you want to solve. Now, I want to bring to your notice that there are 9 steps, 9 levels to assess the maturity level of your technology. Whatever thing you want to build, right? Whatever thing you want to build, you want to, first of all, assess the readiness, the maturity level of your technology. Gauge yourself and tell yourself, okay, this is where I am at the moment. And then that means I'm going to take this next step going forward. Once you know where you are, it gets easy for you to know what next step you're going to take. Step number 1 is concept identified, not validated by peers. And number 2 is theoretically viable, validated by peers. Because of time, I'm just going to rush them. If you have any questions, you can ask later. 3 is proof of concept, demonstrated analytically and experimentally. Then number 4 is you now have a prototype, basic demonstration of functionality under lab conditions. But after lab conditions, you want to also now demonstrate functionality under field conditions. That is level 5. Now, level 6 is piloting testing food systems in a simulated environment. From simulated environment, you go to piloting testing food systems in real environment. Actual production happens, and then you can mass produce. That's the last one line. Now, who should you target as a customer? The non-consumers. There are people who do not have access to solutions already in that your marketplace. You have to target the non-consumers in that sense. Okay, I'm just trying to rush now. Okay, your solution should take care of 6 barriers. 6 barriers, and let's have this as the last slide so you don't need to move further. Your solution should take care of 6 barriers. Number 1 is affordability. Now, this is important for you to note that if you have any public health solution, any innovation, or you're thinking about one, first of all, ask yourself, which of these barriers is it solving for the non-consumer? That is just one question you must ask. Now, number 1 is affordability. Is it affordable? Is it taking the barrier of costs out of the way for the customers? That's number 1. Number 2 is accessibility. Accessibility. In fact, the more your solution is able to have any of these barriers, maybe it has up to 3, 4, 5, the more viable your solution is as an innovation. Accessibility. There are people that don't have access to healthcare today. So a solution like things like mobile health, mobile clinics, they come in and they're able to provide accessibility to healthcare. That is accessibility. That solution is trying to solve the problem of accessibility. Now, the other one is availability. You see, today we're talking about telemedicine. Doctors can just always be contacted just using your smartphone. And that is what availability being solved already. Cultural and social norms. You have issues of sanitation and all of that have to do with culture and social norms. If you develop technology around this, that solves it. You see, simple things like OROS that we know of is solving the problem of lack of awareness and complexity. Because for you to create and develop things around rehydrating, solutions around rehydrating a dehydrated child at home, it involves a considerable level of complexity. But someone just came up with that simple solution, and that solves the problem of complexity. So once you look at, evaluate your solution, and you ask yourself, which of these barriers is it taking out of the way? The more the barriers, the better and the more viable your solution is. All right, I'm going to stop here and then we'll take questions.
Yeah. Thank you so much, Dr. Vici. It was a wonderful presentation. Unfortunately, we are behind time, and we'll definitely have more sessions that will target these topics again. Thank you so much once again, Dr. Vici. Very quickly, I would like to move to our next speaker, Dr. Nathaniel. Next slide, please. He is a Nigerian physician and healthcare innovator, inventor of the jugular venous pressure scale, growth screening wheel, chest meter, and leader of the Labulance project to reduce maternal mortality in rural areas. Currently, he is a Stanford Biodesign Innovation Fellow and a Global Maternal Health Innovation Fellow, committed to medical technology innovation and global health. Most welcome, Dr. Nathaniel, and we are excited to listen to your presentation. Thank you so much. Please, the platform is all yours.
All right, thank you very much.
Yeah, you may share your slides.
Oh, okay, awesome. Let me see if that works. Great. Wonderful. There we go. Yeah, so thank you for having me. Just one thing was missing in my introduction. and that is that I'm a mentee of Dr. Obichi. So he's part of the people who really mentored me on my journey, and he, right from 2021 till now, he's been giving a lot of guidance. So my presentation, thank you very much for having me. It's such an honor to be here to speak with distinguished public health practitioners like yourselves. I'll be touching on the journey from idea to the marketplace in the context of innovation and research commercialization. Yeah, so when it comes to research commercialization, we're essentially talking about um, innovation, because that's how every research project is essentially innovation. So Dr. Obichi has already touched on this in great detail. So we have two major approaches that are well known. He included the third one, which has to do with the industry. But we talk about tech push or tech pull. So innovation push is what he was referring to as the supply approach, supply-driven approach, right? So the most common quote that is associated with this innovation push approach is, if I had asked people what they wanted, they would have said faster horses. And this is attributed to Henry Ford, one of the people that I really looked up to in my innovation journey. I learned so much about him, the good, the bad, and the ugly. Yeah, so for when it comes to innovation push, it's not all bad. There are a few things that are of advantage, and one is that the potential for breakthrough and disruptive solutions are way higher when compared to the pull one. Dr. Obichi also talked about the disruptive or breakthrough innovations. So these section of it usually come out from the push solutions, because these are not things that occur to people that they need. For instance, back in the days, no one thought that they could fly. If you had asked people, how do you want to be transported? No one would have said flying, right? And we have so many technologies today, like the internet. So these are breakthrough innovations that essentially are tech push. They weren't from demand from the marketplace. The other things are, it establishes market leadership, and that's why a lot of R&D is done in large companies in order to keep the dominance of the market, mostly using push or breakthrough solutions. The other one is the pull or the needs-driven, as Dr. Obichi so eloquently stated. So the advantages of this are pretty obvious. There's lower risk on the researcher like yourselves. There's also customer satisfaction, because this is something that usually comes with stakeholder involvement in its development. So usually the outcome of this would be customer satisfaction. And then there's a quicker time to return on investment. So as opposed to the push one, this usually is incremental, like you heard in the last presentation. So the incremental ones usually come from the needs-driven approach method. The most common or the most famous quote that is associated with the needs-driven approach is, necessity is the mother of invention, widely attributed to Plato. So my presentation is kind of going to feel a bit rushed, but it's very simple and mostly pictures. So you're not going to be missing anything much. So there are two pathways, right? When you look at it from the research point of view, especially from a university setting, when you have a researcher working on a project and you're thinking about commercializing it, you're going to find that there are two major paths that you find yourself at the crossroad. So you need to decide, do you want to license it, or are you going to spin out a company? And the most favored way for researchers in the university setting is licensing. And this is done through the institution's technology transfer office, like you heard earlier. De-risking for the innovators is one of the advantages here because there is less liability for the innovator in the sense that it's a shared burden. The university takes on most of those liabilities and not the individual researcher. You don't have continuous financial obligations and you can remain relatively passive. The advantages of these are that you can continue with research and your work as in the university. So that's a very viable option for many, many researchers in institutions. The other way is to spin out a company from your research work. Now, this happens a lot, but it's not everyone's cup of tea. That's my own way anyways, and there are a lot of other researchers that have spun out companies from the work that they did. For this one, you have faster route to market. The reason for this is because you're directly involved, you're putting in pressure, and you know how best to move that technology forward. It's almost like your baby, you know? So that's one of the reasons why it's a shorter route to market because there's a lot of motivation back there. The researchers have more control over the development process. You're not just handing over your research to people to do whatever they want to do with it. You know, so that's another advantage of spinning out the company. The other thing is that the higher the risk, the more the reward, right? We all know this. So if you take on that risk, you're more likely to have more reward in terms of like ownership of the company, the cap table and things like that, you know, due to your higher involvement in building it up as a business. So let's take licensing and look at Stanford University, where I'm currently at now. I'm amazed every day that I interact on the campus and meet people, you know, and do my work. One thing, like for instance, in January, I looked this up, and Stanford at the time was the #1 university in the world. Why are they ranked so high? This is due to the work that the researchers in the university are doing and licensing those ideas and spinning out companies through their technology transfer offices. Look at some of these stats. 3,600 licensing agreements have been generated between Stanford and other companies and has brought in an excess of $1.7 billion in royalties to the university. Last year alone, there were 113 new licenses and $59 million was made just from the revenues they generate from licensing agreements last year alone. For the Stanford office, they have overseen over 11,000 inventions from researchers in that university. So these are the things that make universities like this very great. From the picture you've seen, I don't know if you recognize at least one of the companies on display here. Each and every one of these have been from Stanford alums, and this is just the number I could pack into the slide, right? Google, PayPal, Netflix, Nike, LinkedIn, and all this stuff. Essentially, the university owns a lot of the intellectual property and are licensing these things out. So you can imagine the huge revenue that they're making off this. I'm just saying all of this to make the point that the work researchers do in university settings or institutional settings as a whole is hugely valuable, you know, and that cannot be emphasized enough. But the technology transfer offices have to be taken advantage of and looked at as a major revenue generator and sustainability strategy for institutions around the world. On the flip side is spinning out a company. And I'll just give my own personal story just because it's practical to me, you know, and happy to talk about failures and things like that. But this is one of the quotes that has really kept me going. Do what you can with what you have where you are. This is what Teddy Roosevelt said. And back in the day, when I first started innovating, this was always ringing at the back of my head. And so I am very big on frugal innovation, just using scraps and things around you to build something that is contextually appropriate and sustainable in your locality. So that's really what the journey for me has been. Back in medical school, I was tinkering a lot, I always was questioning why they do things a certain way. That stereotype thinking of healthcare practitioners as a whole. And I'll definitely encourage that every one of you as researchers always try to think outside the box. Uh, there's nothing that cannot be improved upon. So always have that mindset to question things and to find alternative ways of doing it. I started a company just immediately after medical school. I don't want to go into all the story of how that happened because we do not have the time for it. But I just realized that I can do much more with a piece of technology more than I could as a pediatrician, which is what I wanted to be. I just love kids and they were my whole life. That's just what I really wanted to do. But I realized if you build the right technology, you'll be able to scale that and touch much more kids as opposed to what you would have been doing, one stethoscope at a time on the bedside. So I continued doing this. I went in full time, started from the kitchen, used everything I could see from spoons to cutlery. And my wife, I always say, was my first investor because I used up a lot of the utensils in the house building frugal innovations. Yeah, so one of the things that I would encourage every researcher who wants to spin out a company. Like I mentioned earlier, it's not for everybody. It's a very rough ride. I wish I could present all the startup growth curve and you'd see how there are a lot of difficulties involved with it, but it's absolutely worth it if you're that kind of risk taker. But you need a lot of perseverance and innovation. Some of the machines that we use when we couldn't afford it, we tried to build things that we can use. And that's one of the ways I scaled one of my innovations, the growth screening wheel, which is used for screening malnourished children in rural areas, and their own mothers, even if they're not educated, would have an idea of the growth status of their kids and know how to seek for intervention. So why I'm showing all of this is just to show, going back to the quote that I mentioned earlier, start with what you can, do what you can wherever you are with what you have, right? So don't wait. That's just the point I'm trying to say. Don't wait until all your ducks are lined up in a row. Start with something, but always do your research because like I keep stressing, building a company, it's not for everyone, but if it is for you, you have to be persistent and innovative. So this is just showing the growth process of adoption gradually, and this has taken years. It's another thing again about spinning off a company. It takes time. It takes time. It's not, you don't, it's not something to rush. Yeah, let me just put it that way. But I can't overemphasize that working as a team. So if you work as an individual, you can do that only for so long, and then you run out of your wits, you run out of your capacity, you run out of your abilities. But two heads, like they say, is always better than one, right? And I have been fortunate to work with, to partner with people much smarter than I am, much more talented than I am, and then we've built the company using everyone bringing in their own contribution on to the table. But I'm just trying to show you that starting from an idea as a medical student and persisting and holding on to it, you're able to gradually, if you follow the process, to build a company. So it's possible, and that's just the point I'm trying to make. So our company, we've kind of split it into 4 different departments. It's a strategy thing for us and a survival thing for the company. Being in a system like Nigeria and Sub-Saharan Africa, it has its positives and then it has its own challenges. It's not all bad. Many things about it is rosy, and we don't emphasize that enough. So I had a dream of having a place where we can essentially look like a company and bring everybody together and put resources there where we can build innovations. This was just a dream. I sketched this up and it was always by my bedside. This was the dream for me. And I had the opportunity to have like shops, like 2 shops, 3 shops. And so I just combined the shops together and gradually tried to start building up the company. It's one person at a time, one brick at a time, one partner at a time. That's how you build it and you keep going, but you have to persist. And today we have the center, which we're calling the Health Innovation Center. It's located in the northern part of Nigeria, and we're really trying to drive homegrown innovation that cater to the needs of the healthcare system from the ground up, from the most vulnerable, especially women and children. I'm very biased towards technologies that help children and mothers in rural areas. So we have some things going on. This is our flagship project. I wouldn't go too much into it. Dr. Obichi has talked about access. That's what it's all about. I'm taking maternal and child health innovation and interventions from to the doorstep, essentially, serving and supporting maternal community healthcare workers and traditional birth attendants. So we had a launch and they were pretty excited about it, but we are planning to scale these on a needs-driven approach. So we want them to be the drivers of what the innovation looks like. So they were part of the iterations that we had in remodeling what we have today. Yeah, and then from there, I had the opportunity to be at the Stanford Biodesign, where we worked on some interesting research, which of course, coming from Stanford, would be licensed through the Technology Transfer Office, and then a company would be spun out of that through licensing. So that's the strategy Stanford has been using. What we worked on was a way to improve treatment of hepatic encephalopathy in chronic liver disease patients to reduce rates of hospital readmissions. The other thing was a way to screen for high-grade serous ovarian carcinoma in patients who are at high risk of ovarian cancer due to hereditary syndromes to avoid unnecessary oophorectomies. We fought long and hard on this one, especially that it had to do with maternal health, So I was very passionate about this. My colleagues and fellows were very passionate about this. We fought and fought and fought and fought, but it's still a battle that's going on. It's a very difficult space. But why am I saying all of this? I don't know what you're working on as a researcher, wherever you are, but it's hard, even for Stanford. Many things are difficult, and that's the part you don't see. They're fighting so hard because something is so frustrating, it's so difficult, but they do not give up. They keep going on and going on. And if you are from an LMIC or the Global South, as they like to call it, it matters even more for you to be persistent. So we should be attracted to things that are difficult, The goal of life is not ease. It's not ease. It's through those difficulties. It's overcome. That's why we have the word breakthrough, right? Breaking means there was something hard that you had to penetrate. So we have a lot of things that are very difficult there, and which means that we have the most opportunity for both incremental and disruptive innovations. Thank you for your time. I'm happy to join Dr. Obichi in taking questions.
Thank you so much, Dr. Nathaniel. I think this session has been an amazing one, especially for those who are very new to this and would like to step into entrepreneurship or innovation. I think this is now the time where we need to bring in our audience and request them to ask any question that they might have from the audience. Already there are few questions from the chat, and I would like to ask you, just a minute. There's a question for Dr. Obichi. What key performance indicators should researchers track to assess the success of their commercialization efforts? Dr. Obichi?
Then instead of, because of time, we take all the questions, then address them, right? So everybody can bring all the questions, then we take all of them together.
Okay, so one is what key performance indicators should researchers track to assess success of their commercialization efforts? Another question is basically how can we, just a minute, how can we create an environment that empowers and supports women in bringing their innovative ideas to market? And for Dr. Nathaniel, there's a question that asks, what is the role of the incubators in developing an innovation or innovative idea? And is this really necessary to get incubated? And how do we choose them? So here are the questions for you both.
Okay, thank you very much for that question on the key performance indicators. So I want to give you very quickly some, I'll call it just about 4 things you want to note. 4 things you want to note when you're driving your innovation efforts as a researcher. Number 1 is the technology readiness level. Then number 2 is commercial readiness level. Number 3 is market readiness level. And number 4 is management readiness level. Let me talk briefly on the technology readiness level. I did touch it a bit during my presentation, but there are 9 levels really. The essence here is for you to begin to track the growth and the maturity of your technology. For every innovation, there is a technology. That is something you want to note. For every innovation, there is some improvement, there's some technology, there's some leverage. So that concept, that idea would have to grow in maturity over a period of time. And the final stage is where you have something tested, something piloted, something that is now ready to be used to get into the hands of end users. That is the 9 stage. These are the 9 stages, right? The 9 stages where actual production in real environment, in actual environment. So that is, so you begin to track your technology all through that process. Now, the other one is market readiness level. It is not all technology, no matter how advanced that technology gets to, that has a ready market for it. Some technologies, there is no market for it, or the market is so tiny, so small, or the market is not growing. Okay, so you want to make sure that you have a technology that is ready, you have a market that is ready. So that is something you also track. You want to begin to measure all of this, the market. Then the commercial viability, very important. I may have a market, I may have a product, but for goodness sake, there's no viability around it. Right? So the point is that I don't see a customer that is willing to pay me well enough to cover the weighted cost of capital and to drive the sustainability for my technology, for my innovation. Now, this is important. You want to get these 3. Very important. When you have gotten these 3, we now go to the most important that you need to track, which is management. That is team. Dr. Nathaniel talked about it. You cannot do this alone. So I have graded management readiness level in 3 levels. Number 1 is at the point where you're working on this thing with your, self and your tiny research group.
Right.
That is the first. In fact, the level 0 is when it's only you. Then level 1 is when it's you and that your research group. Now, level 2 is when at the point where you need to go through the bureaucratic bottleneck of your organization or your institution, wherever you have found yourself, whether you're in a university or you're working with any organization, there is always that point where you want to break out of that institution. That is a bottleneck. That is something you want to track. That is level 2. Now, level 3 is the commercial team. you as the researcher is not necessarily going to be the person to drive this in the marketplace. Very important. So the third level in management readiness level is to have that commercial team that is going to now, you're going to recruit them, you're going to bring them on board to become co-founders of your innovation, and then they're going to take this to the market, raise the funds, and do some of the necessary things that should be done while you remain a public health practitioner whose vision is being driven towards solving a very important and a worthy public health problem. Thank you.
Yes.
I want to believe I answered that question. Then the other question was, how do we create solutions for
For
maternal
women. Yeah,
for
women.
women?
Yeah, for women, basically, because there is work-life balance that we need to maintain, and we by default, women are disposed to, they're supposed to do all the household chores and then
Okay.
go
I
for
get
their
it.
passion as well. So how do we encourage women to go ahead and take this step?
Yes. So the point is this, like we've emphasized, no person should do this alone, right? So whether you're a man or you're a woman, but even more so for women, you may have the idea. You may be so brilliant to come up with the concepts and all of that. But hey, nobody expects you to, this is not a journey you can go on alone. So you have to engage other people, either other women, and collaborate, synergize efforts, or bring men now to support, right? You're not supposed to do it. That's the first thing you want to note. So whether you're a woman, you have other things doing domestic and all of that, please, you have to synergize efforts with others, build a team. That is something that is critical. And that is what I have to say about how women can get involved. Get involved through partnership, get involved through collaboration. Please, that
Yeah.
is something very critical. Yeah.
Yes, I will be coming back to you, Dr. Obichi. There are few questions that the audience has asked, but I want to go to Dr. Nathaniel for getting our answer on why incubators are important, or are they really important? Do we really need them to go ahead and get the innovation done?
Yes, thank you for that question. Definitely incubators are very, very necessary and important. From the word incubator, you'll understand that an incubator is something that nurtures something that's delicate, like an egg, for instance. And that's really how ideas are. They're very delicate in the beginning. They're absolutely not ready for the hostile environment of the real marketplace. And so they need a simulated environment in order to be able to grow. Just like you have a chick hatching from an egg, but it's not yet ready for the wild. That's exactly the way it is. So what you get out of that, you get technical support, you get market readiness, and you get capacity building, which are very, very essential. Now, nobody knows everything. There are several components required to take your idea to the marketplace. And no single individual has each and every one of those competencies. So you need other people's input, and that's why Dr. Obichi is also stressing that you need partners, you need people in order to build that up. So incubation hubs are a very, very good, it's not the only way, but it's one of the most efficient ways of taking ideas and getting them ready for the marketplace. The other part of the question was, how do you choose incubators, the right incubators? I would say that there are two very essential things that are important. You need to understand the problem you're trying to solve and the outcome that's going to come out of solving that problem. So if you understand the problem and you understand the outcome, the part in between, you would now use that to know which person is best suited to help you take the problem in order to accomplish the outcome. But if you don't understand these two components, it will be difficult. So I'll say start from understanding the problem and the outcome you seek to achieve. Yeah.
Thank you so much. And there are two questions, and I think both of them are like burning questions. So I would go to both the speakers. First one talks about the confidentiality of the patient's data. How do we make sure that the data is secure and we are not going towards in the wrong direction to commercialize any research data that we have produced so far. And the other question is, how do you deal with expectations from local authorities who have regulatory responsibilities over public health innovations? So these two both, I would like to listen to both these speakers on these two things, which are really important and might a researcher might definitely find it as one of the biggest hurdles, and kind of ethics part also plays a very important role over here. So what are your views on this?
Okay, let me just say something very quickly about expectations from local authorities who have regulatory responsibilities over public health innovations. Yes, if you're driving a public health innovation, you should expect regulatory hurdles. That is, good for the society anyway. But the thing is this, you have to have an early strategy. You have to have a regulatory strategy early enough in the process. You don't wait until you get to the point and then you begin to run helter-skelter. That is wrong. Have a regulatory strategy, then have your timeline and begin to engage adequately with these different stakeholders involved. Understand what is required. Keep putting the documentations ready for when the time comes. The problem is usually not that you're regulated. Most of the time, it is that you're not ready, you're taken unawares, you don't know what to even expect from the beginning and when you're planning your innovation process. So that is important, having an early regulatory strategy. That is number one. Then on the question and of course, you have to engage with them. There is this pre-assessment meeting I encourage everyone. Like if you want to get here in Nigeria, our FDA is called NAFDAC. So you want to meet with NAFDAC, I encourage you have a pre-assessment meeting with the people working there at NAFDAC, and let there kind of a dry run, if you may, just know what to expect, and have them do their job. But it's important. The next one is on data. Interestingly, you asked an important question, and I'm currently a licensed data protection and compliance officer in Nigeria. And the thing is this: if you want to collect any personal data as a researcher, please, first of all, make sure you have passed through the ethical committee of your institution. There is the local ethical committee of your institution. If you want to do research and collect personal data on individuals and all that, make sure that is sorted. That is number one. Number two is there is what we call auditing, of your data and all of that. That's basically data governance. So what happens is that you're supposed to self-audit yourself. There has to be someone that is working with you in your team that is trying to make sure that the different touch points of between your solution or your technology to a particular client or patient in that case, make sure is well, the security is high, make sure that everything is put into place to ensure privacy of those data, make sure it's secure, adequately, make sure every I is dotted, every T is crossed. There are, we call it auditing. There are things, check boxes you need to tick to make sure that there is no way in which you can basically how do I say, you cannot jeopardize the data, personal data of your clients, of your patients. It's very important. We cannot stress this enough. Personal data you're collecting from your patients, please make sure you put every measure in place to safeguard them.
Yeah, thank you very much. I do not disagree in any way with anything Dr. Obichi has said. When it comes to data protection, I would say there needs to be a lot of self-education in this regard. So a lot of people are not very knowledgeable about those things. And so before you start, it's good to understand what those laws are. Because many times you just jump into doing research without even knowing what the oversight concerning those things are. So extend your research beyond just the project you're working on and see what the regulatory framework around such a project is. That way, at least you're pre-informed and then you know what to expect. The other thing again about dealing with authorities is that just like Dr. Obichi said, you need to have a mindset where you view them more as collaborators rather than as the opposition, and that's one of the things I think we as researchers need to begin to develop. It's how to start those early engagements. So some of these oversight bodies become less nervous when they're seeing the thought process and the progression of what you're doing. If you came up with them and said, this is what we're going to start, this is what we're going to do, and they give their input right from the start, you take them also as stakeholders in the project, then that way you're de-risking any kind of negative impact from authorities. So definitely early engagement cannot be overemphasized, and we need to look at them more as collaborators rather than opposition.
That has been an amazing session. I think, Janet, would you be willing to ask any question? Or anyone else would like to ask any question from the speakers? I think this has been an amazing time, and listening to both of you, Dr. Nathaniel and Dr. Obichi. I think whatever we have listened to you, and whatever we are going to take forward, I think this definitely is going to make somewhere maybe a small impact, and maybe women entrepreneurs, women innovators can come forward, can also collaborate with the other innovators from across the world. And of course, IMPH alumni can come together and also bring in the platform that we have, Public Health Innovation Hub, to support any innovation in the field of public health. I would now call upon Shira to thank the audience and conclude this amazing webinar that we had today. Yeah.
Hi, everyone. My name is Shira Nanavati. I'm the IMPH Alumni Communications Coordinator. And I just wanted to thank everyone for joining us and to thank our incredible speakers, Dr. Obichi, Dr. Nathaniel, and Ridula. It's been an incredible webinar, very informative, and really the first of what is to be a series of webinars by this group. Everyone should take note that the next webinar will be on September 26th. One more thank you is for the IMPH Innovation Hub training team that put this webinar together, and who will be working on this series. And in general, if anyone wants to be a part of this group, you can reach out to me Obichi, Maridula, anyone on the training group, or Obichi can help you figure out which group within the Innovation Hub you'd like to be part of. So please stay tuned for more to come. Thank you guys again, and wishing everyone a wonderful day.
Thank you so much, Shreya.
Thank
Thank you
you.
so much. You have been a great audience. Thank you so much, everyone.
Thank you,
Maridula, you're
everybody.
on mute.
Thank you,
Thank
Maureen,
you.
for staying through the section. Thank you, Maureen.
Thank you.
Good to see everybody. Well done. Well done. Thank you so much.
Thank you.
Thank you, Maureen.
Bigger and better.
Thank you, everyone. I'm closing the meeting.
Yes,
Thank you,
meeting closed.
everyone.